My name is Dr. Paul Vitulli. I'm an interventional radiologist and medical director at Duval Fibroid Center in Jacksonville, Florida. Uterine fibroids are a non-cancerous growth that develops from the smooth muscle tissue in a woman's uterus. Up to 200,000 women are diagnosed each year with uterine fibroids. Many more women have fibroids if they're not diagnosed, if they're not symptomatic. But the women who do have symptoms, they usually will complain of pelvic pain or pressure, low back pain, heavy menstrual bleeding, prolonged periods, painful sexual intercourse. Some women will complain of difficult conception. Some women will complain of fatigue due to anemia. Those are the most common symptoms that we see. If the symptoms get much worse and the fibroids enlarge, some women get frequent urination and constipation as well. So obviously women are going to have uterine fibroids because they have a uterus. Women who are most likely to have them are any woman that has a family history. So if their mother had fibroids, they would be at risk. Any woman that had an early period onset also has a higher risk. Ethnicity differences, women of color have a higher risk than Caucasian women, and those are the biggest risk factors. Being obese is another risk factor as well. There aren't too many complications that can occur. One thing that happens occasionally if the fibroids are on the inside of the uterine lining, those are called submucosal fibroids, that can make it harder for a woman to conceive. Another complication that's more frequent that I see in my practice is women who have prolonged heavy bleeding can actually become anemic, and that really will affect their lifestyle where they're very fatigued and lethargic throughout the day. They may even need a blood transfusion. Most women are probably diagnosed with fibroids when they go to their gynecologist, and the gynecologist may do a physical exam and feel some changes in the uterus itself. Many imaging studies are performed to further evaluate the uterus. Ultrasound is a nice way to see the uterine fibroids. MRI is probably the best way to see the number of fibroids, the location, and the vascularity that the fibroids contain. Only symptomatic fibroids need to be treated. As we mentioned previously, many women may have fibroids and have no symptoms. They do not need to be treated because they are not cancerous tumors. If the tumors do enlarge and cause other problems, like we mentioned, chronic pain, heavy bleeding, other issues, then we recommend treatment for those fibroids. Some women will try medical therapy first, which could just be oral contraceptive pills, birth control pills. There are other medications that actually have some hormonal effects to put a woman into a menopausal state, which is quite unpleasant. So those are some of the medical options that can be performed. There are other more aggressive treatments like surgical options, which is the most aggressive would be hysterectomy and myomectomy. Those have some significant pain and also some recovery time seems to be a little bit longer for those types of procedures, and more minimally invasive procedures such as uterine artery embolization. Uterine fibroid embolization has a lower recovery time. Patients will have some discomfort, certainly not as much or as long as a hysterectomy, maybe for 1 to 2 days. We expect a woman to go back to work within 1 to 2 weeks from a uterine fibroid embolization, unlike a hysterectomy, which could take 6 to 8 weeks for full recovery. If you have any questions or suspect that you may have uterine fibroids, please don't hesitate to give our office a call or visit our website. Thank you.